Bismillahirrahmanirrahim. We are going to talk about the phrenic nerve, which is receiving sensory fibers from the pleura, the pericardium, the peritoneum, and the diaphragm, and it is giving motor supply to the diaphragm. So, because it is receiving sensory fibers and giving motor supply to the diaphragm, that is why we call it that it is a mixed nerve. Take a mixed nerve is a nerve which has both sensory and motor fibers. Its origin is via the C3, C4 and the C5 cervical spinal nerves, the main one being the C4. And this C5 fibers, they're coming sometimes indirectly via the nerve to subclavius. Okay, when it is coming indirectly via the nerve to subclavius, then it is called accessory phrenic nerve, and that accessory phrenic nerve courses lateral to the main phrenic nerve in front of the subclavian vein, and it joins the main phrenic nerve in front of the first rib or at the root of the lung. Okay, so we have discussed the origin, which is coming via the C3, C4 and C5. We have to talk about the anterior relations. First, you can see over here that this phrenic nerve is crossing in front of this muscle, which is the scalenus anterior from the lateral to the medial side. After crossing this muscle, what are the structures that are anterior to it? Let's discuss those. So anterior to it is the prevertebral fascia that is enclosing the sternocleidomastoid and the inferior belly of the omohyoid, and there are a few arteries, one of them being the thyrocervical trunk, which has two branches which are just exactly in front of the phrenic nerve. So one of them is the transcervical artery and the other one is the suprascapular artery. These two branches are anterior to the phrenic nerve. After that, the internal jugular vein is also anterior to the phrenic nerve. The thoracic duct is anterior to the phrenic nerve on the left side. Okay, after that, the phrenic nerve, it crosses the cervical pleura, which is the pleura at the apex of the lung, in behind the commencement of the brachiocephalic vein. The brachiocephalic vein is formed by the subclavian vein and the internal jugular vein. So behind it, the brachiocephalic vein commences, and behind this point, it crosses the cervical pleura. After crossing the cervical pleura, it crosses the internal thoracic artery from the lateral toward the medial side, and it enters into the thorax behind the first rib or behind the costal cartilage of the first rib. Okay? Then it enters the thorax to give it sensory and motor fibers. Talking about the left phrenic nerve crosses the medial margin of the scalenus anterior at a higher level. And the other difference in the left phrenic nerve, अभी जो मैंने आपको पहले बताया था, that was the right phrenic nerve का course. Left phrenic nerve is a little higher. ठीक है, it crosses the medial margin a little higher. And the other thing is that the left phrenic nerve lies in front of the first part of the subclavian artery, whereas the right phrenic nerve was crossing the thyrocervical trunk, which is a part of the second part of the subclavian artery. So this was all about the phrenic nerve.